What's up, everyone? Welcome back to the channel. Today, we're diving into something super important but kind of complex: ulcerative colitis versus Crohn's disease. Don't worry, I'm going to break it down so it's easy to get, like explaining Fortnite to your grandma. These are two conditions that affect your gut, and they're part of something called Inflammatory Bowel Disease, or IBD. IBD is like your gut throwing a tantrum, causing inflammation, which is when things get swollen and irritated. Think of your gut as a long, wiggly tube that helps digest food. IBD messes with that tube. Ulcerative colitis and Crohn's disease are like cousins. They're similar, but have some big differences. Let's start with the basics. Both can make you feel pretty crummy, but they act differently in your body. First up, where they happen in your gut. This is a big deal. Ulcerative colitis only affects the colon. That's the large intestine, the last part of your digestive system. Crohn's disease? It can pop up anywhere in your digestive tract, from your mouth to your butt. Imagine your digestive system like a long water slide. UC only messes with the end of the slide, but Crohn's can mess with the whole thing. Another difference? How deep they go. UC only affects the inner lining of the colon, like scraping the frosting off a cake. Crohn's goes deeper, affecting all the layers of the gut wall, like slicing through the whole cake. This makes Crohn's a bit more intense in some ways. Let's talk symptoms, aka how these make you feel. Both can cause tummy pain, like that feeling when you eat too much pizza and regret it. Diarrhea is super common in both, like running to the bathroom all the time common. You might see blood in your poop with UC because it causes ulcers in the colon. Crohn's can cause blood too, but it's less common since it's not always in the colon. Feeling super tired? That's fatigue, and both UC and Crohn's can make you feel like you ran a marathon. Weight loss can happen because your body isn't absorbing nutrients properly. It's like your gut is saying, nope, not digesting that burger right. Sometimes you might not feel hungry at all. Both diseases can mess with your appetite. Now here's a weird one. Both can cause problems outside your gut. Like, you could get joint pain, making your knees or elbows feel achy. Skin rashes can show up like annoying red bumps. Even your eyes might get irritated, feeling red or itchy. It's like your body's throwing a full-on protest, not just in your gut. Okay, let's talk about how doctors figure out if you have UC or Crohn's. They'll ask about your symptoms, like, how's your tummy feeling? Or, how many bathroom trips today? They might do blood tests to check for inflammation or anemia, low red blood cells. Stool tests, poop tests, can show if there's blood or inflammation in your gut. Imaging tests like an X-ray or CT scan let doctors peek inside your digestive system. The big one? A colonoscopy. It's when they use a tiny camera to look inside your colon. Don't worry, you're asleep for it. It's not like they're filming a TikTok in there. For Crohn's, they might also check your small intestine with something called an endoscopy. These tests help doctors say, yup, it's UC, or nope, it's Crohn's. Now, who gets these diseases? Spoiler, it's not just old people. Teens and young adults can get UC or Crohn's, sometimes even kids younger than you. It's not super common, but about 1 in 100 people have some form of IBD. Boys and girls get it about the same, so it's not picky. It can run in families. If your mom or dad has it, you might have a higher chance. But it's not like catching a cold. You don't catch UC or Crohn's. Scientists think it's a mix of genetics, your immune system acting wild, and maybe stuff like stress or diet. Speaking of diet, let's talk about food and these diseases. Certain foods might make symptoms worse, like spicy tacos or greasy fries. But food doesn't cause UC or Crohn's. It just makes your gut angrier sometimes. Some people feel better cutting out dairy, like milk or cheese. Others avoid high-fiber stuff, like popcorn or raw veggies. It's like trial and error to find what works for your tummy. Now, how do you treat these? Because nobody wants to feel crummy forever. Medications are a big part of it, like anti-inflammatory drugs to calm your gut. For UC, you might use meds like mesalamine to soothe the colon. Crohn's might need stronger stuff, like biologics, which are like superhero drugs for your immune system. Sometimes steroids, not the gym kind, are used to chill out inflammation fast, In tough cases, you might need surgery. For UC, surgery might mean removing the colon. Yep, the whole thing. After that, UC is basically cured, but you'd poop differently. Crohn's surgery might remove damaged parts of the gut, but it can come back elsewhere. Surgery sounds scary, but it's rare and only for really bad cases. Lifestyle changes help too, like eating smaller meals or staying hydrated. Stress can make things worse, so chilling out with video games or music might actually help. Exercise is great too, like shooting hoops or dancing, to keep your body strong. Let's talk flares, when symptoms get super bad. Both UC and Crohn's have good days and bad days, called flares in remission. A flare is like your gut throwing a tantrum, with lots of pain and bathroom trips. Remission is when you feel normal, like your gut's finally behaving. The goal is to have more remission days than flare days. Okay, quick recap. UC is colon only, surface level. Crohn's is anywhere, deeper. Both cause tummy troubles, fatigue, and sometimes weird stuff like joint pain. They're not curable yet, but treatments can make life way better. Now, what's it like living with UC or Crohn's? It can be tough, especially if you're missing school or hanging out with friends. But tons of people manage it and still do awesome things. Like there are athletes and celebs with IBD living their best lives. Talking to friends or family about it can help. They might not get it at first, but they'll learn. Joining support groups, even online, can connect you with other teens who get it. It's okay to feel frustrated sometimes. It's a lot to deal with. But you're not alone, and doctors are always finding new ways to help. Oh, and fun fact, IBD isn't the same as IBS, irritable bowel syndrome. IBS is less serious, more about stress or food triggers, and doesn't cause inflammation. UC and Crohn's are bigger deals because they physically damage your gut. All right, let's wrap this up with some hope. Research is happening all the time to find better treatments and maybe even a cure. If you or someone you know has UC or Crohn's, talk to a doctor about what's next. Knowledge is power. Understanding this stuff helps you take control. You're tougher than the toughest boss in a video game, and you got this. That's it for today. If you learned something, smash that like button. Got questions about UC, Crohn's, or something else? Drop them in the comments. Subscribe and hit that bell icon so you don't miss our next vid. Stay awesome, stay curious, and I'll catch you in the next one. Peace.